Ebola is a highly severe viral infection that has captured global attention due to its deadly nature and sporadic outbreaks. It is classified as a hemorrhagic fever causing severe internal bleeding and multiple organ failures. Primarily found in Africa, Ebola's impact is felt worldwide due to our interconnected global community. The virus was first identified in 1976 near the Ebola River in the Democratic Republic of Congo. The most significant outbreak occurred in West Africa between 2014 and 2016. Ebola's high mortality rate, ranging from 25% to 90%, underscores the importance of early detection and prevention. Despite its severity, Ebola is not as easily transmitted as some other viruses, offering hope for containment. Ebola transmission occurs primarily through direct contact with the bodily fluids of an infected person or animal, which makes it different from airborne diseases. This contact could be with blood, saliva, sweat, vomit, or other secretions. The virus enters through broken skin or mucous membranes. Handling or consuming infected animals can also spread the virus. Outbreaks often start in remote villages near tropical rainforests. Animals like fruit bats and monkeys are believed to carry the virus. Contaminated objects like needles or medical equipment pose a risk. Lack of protective equipment in healthcare settings can lead to infections. Ebola does not spread through air, water, or food. Understanding these modes allows for targeted preventive measures. The symptoms of Ebola can appear anywhere from 2 to 21 days after exposure to the virus, making early detection both challenging and critical. The initial symptoms are often non-specific and resemble those of other common illnesses, which can complicate diagnosis. These early symptoms include fever, severe headache, muscle pain, and fatigue. As the disease progresses, more severe symptoms develop such as vomiting, diarrhea, abdominal pain, and unexplained bleeding or bruising. These symptoms are indicative of the virus's attack on the body's blood vessels and immune system, leading to hemorrhagic complications. This progression underscores the importance of monitoring for symptoms in individuals who have been exposed to risk factors. One of the significant challenges in diagnosing Ebola is that its symptoms overlap significantly with those of other tropical diseases such as malaria, dengue, and typhoid fever. This overlap necessitates laboratory testing to confirm Ebola infection, which can delay treatment and increase the risk of transmission during the diagnostic process. Prompt recognition of symptoms and immediate medical evaluation are essential in managing Ebola outbreaks. This early detection not only improves the chances of survival for the patient, but also helps in preventing further spread within communities. Immediate medical attention is paramount once Ebola symptoms are suspected, particularly for those who have had potential exposure to the virus. Quick response and isolation of suspected cases are crucial steps in preventing the spread of the virus to others. The sooner a person with suspected Ebola is isolated, the better the chances of containing the outbreak. Healthcare facilities must be equipped with the necessary tools to test and manage Ebola cases effectively. This includes having access to personal protective equipment, proper isolation wards, and trained medical personnel. In many affected regions, the lack of these resources has been a significant barrier to effective outbreak control. Treatment for Ebola focuses on supportive care, as there is no cure for the virus itself. This care includes rehydration, managing symptoms, and treating complicating infections. Experimental treatments and vaccines have shown promise, but their availability may be limited during the initial stages of an outbreak. The community's role in reporting and supporting individuals exhibiting symptoms cannot be overstated. Public awareness campaigns and education are vital in encouraging individuals to seek medical attention promptly, reducing stigma, and fostering a collaborative approach to managing the disease. Section 5. Prevention Strategies for the General Public. Preventing the spread of Ebola begins with understanding and implementing effective personal and community hygiene practices. One of the most straightforward yet effective measures is frequent hand washing with soap and water or using alcohol-based hand sanitizers. This practice helps eliminate the virus from the hands, which are often vectors for transmission to oneself or others. In areas prone to Ebola outbreaks, safe food preparation and consumption are crucial. This involves thoroughly cooking meat, especially bushmeat, and avoiding contact with raw animal products. These practices help minimize the risk of zoonotic transmission, which is one of the primary avenues for the virus to jump from wildlife to humans. Avoiding direct contact with individuals who are sick or have died from Ebola is another critical prevention strategy. This includes avoiding traditional burial practices that involve touching the body, which has been a significant factor in past outbreaks. Education and community engagement are essential in modifying these cultural practices to prevent transmission. By adopting these prevention strategies, individuals and communities can significantly reduce the risk of infection, contributing to the overall control of Ebola outbreaks. Public health messaging plays a vital role in disseminating this knowledge effectively. Section 6. Protective measures for healthcare workers. Healthcare workers are at the highest risk of contracting Ebola due to close contact with patients. Ensuring their safety requires training, resources, and strict infection control protocols. PPE, including gloves, masks, gowns, and goggles, is essential for protection. Proper training in PPE use and disposal is crucial to prevent exposure. Training in patient handling and isolation techniques minimizes transmission risk. Adequate supplies and equipment are necessary to support these practices. Support systems, including mental health resources, are essential for healthcare workers. Safeguarding healthcare workers ensures an effective response to Ebola outbreaks. Section 7. The role of Ervebo vaccine. The introduction of the Ervebo vaccine has been a significant breakthrough in the fight against Ebola, providing a critical tool for protecting high-risk individuals, especially healthcare workers and those living in outbreak areas. The vaccine has been shown to be highly effective in preventing Ebola virus disease, which is a significant advancement in public health. Ervebo is a single-dose vaccine that was granted approval by the World Health Organization in 2019. It is specifically designed to combat the Zaire Ebola virus species, which has been responsible for the majority of outbreaks. The availability of this vaccine has transformed the approach to managing and preventing Ebola outbreaks, offering a layer of protection that was previously unavailable. The vaccine is typically administered to individuals who are at immediate risk of exposure, such as healthcare workers and people who have been in contact with someone infected with Ebola. This targeted vaccination strategy helps to create a protective ring around outbreaks, reducing the potential for the virus to spread further. While the Ervebo vaccine represents a major step forward, it is not a standalone solution. It must be combined with other public health measures such as surveillance, contact tracing, and community education to effectively control and eventually eliminate Ebola outbreaks. Section 8. Reassuring public awareness. Despite the severity of Ebola, it is important to reassure the public that the risk of contracting the virus outside of affected regions remains low. This reassurance is vital in preventing panic and ensuring that resources are directed where they are most needed. Public awareness efforts should focus on educating people about the actual risks and the effectiveness of current prevention and control measures. The fear surrounding Ebola often stems from a lack of understanding and the dramatic nature of its symptoms and mortality rate. By providing clear, factual information, public health organizations can help demystify the disease and promote rational responses to suspected cases. This approach is crucial in reducing stigma and encouraging individuals to seek medical attention when needed. Engaging with communities through local leaders and health workers can foster trust and improve the uptake of preventive measures. Tailored communication strategies that respect cultural contexts and address specific concerns can enhance the effectiveness of these efforts. Public health campaigns should emphasize the role of individuals in protecting themselves and their communities from Ebola. By maintaining an informed and vigilant public, we can ensure that any future outbreaks are met with swift and coordinated responses, minimizing the impact on affected communities and preventing global spread. Section 9. Call to action for public health engagement. In conclusion, while Ebola remains a formidable challenge, it is one that can be met with knowledge, preparation, and cooperation. The key to safety lies in understanding how the virus spreads, recognizing its symptoms, and implementing effective prevention strategies. For those in high-risk areas, the availability of vaccines like Ervebo adds an invaluable layer of protection. We invite you to stay informed about Ebola and other public health issues. Engaging with credible sources and participating in community health initiatives can empower individuals and communities to face health challenges effectively. Remember, your voice and actions are vital in the global effort to combat infectious diseases. Please share this information with your network and encourage others to learn more about Ebola and other health topics. Like, subscribe and comment on our platform with topics you are interested in learning about. Together we can build a healthier, more informed world.